Next, we're going to talk about a variety of different soothing techniques that you can utilize to help your fussy little one. First off, it's important to know that you should meet all of the basic needs first. So, check if your little one's hungry, do a diaper change, and then take a look at that clock to see if the wake window's expired. It might be time for a nap. If all of those things are taken care of, it might just be that all the crying is because they're a little extra fussy. Dr. Harvey Karp is an American pediatrician who's known for developing a soothing mechanism called the 5 S's. When combined together, the 5 S's work great to recreate womb-like sensations, triggering the calming reflex in newborns. The 5 S's are swaddle, side, shush, swing, and suck. While the goal of the 5 S's is to calm and not necessarily put your little one to sleep, many newborns will settle down and fall asleep quickly during the 5 S's. The first S, swaddle. Swaddling helps to recreate the snug fit inside the womb and is the cornerstone of calming. It helps to decrease the startle reflex and increase sleep. Swaddled babies respond faster to the other 4 S's and stay soothed longer because their arms can't wiggle around and move. Remember, to wrap the arms snug, keep them straight down at their sides, but let the hips be loose and flexed. Babies shouldn't be swaddled all day, just during those fussy times and sleep. The second S is side. The back is the only safe sleep position, but it's the worst position for calming fussiness. This S can be activated by holding your baby on their side or stomach across your forearm. After you've completed the 5 S's and perhaps they've fallen asleep, if you're going to lay your baby down, make sure they're on their back. Next, shush is the third S. You'll recall from earlier, babies don't need total silence to sleep, especially in the first couple of days and weeks. Some amount of white noise is calming to them. In the womb, the sound of the blood flow is the shush louder than a vacuum cleaner. To help encourage the calming reflex, you can lean down and make a shushing sound close to your baby's ear. Shh, 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 shh. It should be as loud as your baby is crying. The fourth S, swing. To help encourage that calming reflex, you need to use fast, tiny motions to soothe. Your baby is positioned on their side across your forearm with their head in your hand. In this position, you'll move their head gently back and forth in a jiggling motion. Keep your motions small and move no more than 1 inch back and forth. Now we have suck. Sucking is a quick way to enact the calming reflex. Many babies do this naturally by sucking on their fingers, hands, or even their lower lip. They also feed to soothe. You can encourage sucking on a pacifier, a parent's clean finger, or mom's nipple while engaging in the other 4 S's. In addition to the 5 S's, there's a variety of ways that you can soothe your little one. It's important to find different ways to soothe your baby. Think of it as multiple tools in your toolbox. If one method doesn't do the job, then you can try something different. You can hold, rock, bounce your baby on a yoga ball, wear them in a sling or in a carrier, go for a walk, go for a ride, maybe in the stroller or car. You can also vibrate them. Infant seats and bouncers usually come with some sort of vibrating mechanism that can be very soothing for your little one. In addition to that, you can always rely back on a feeding session to help calm your fussy baby.
Don't worry, you've got this.